Hi, my name is Andrew Decker, and I'm the program supervisor for our new mobile unit here in St. Albans. We're an extension of our St. Albans Outpatient Treatment Center and Safe Recovery located in Burlington. We want to offer a harm reduction and low barrier approach to seeking any substance use service and to be able to provide substance use service specifically for people struggling with opioid use addiction. We've identified there to be lots of barriers, especially here in Franklin County and in Grand Isle County, around seeking services and staying engaged in services for the long term. One of those barriers being transportation. We are stationed out of St. Albans, and we are currently offering services in Richford, Vermont, in Swanton, Vermont, and soon to be in Albans, Vermont. We're a completely walk-in service. We can schedule appointments if that's what is best for somebody. What we are finding with the complicated nature of what substance use is now, people enter recovery at all sorts of different stages, and our first task is to say, what can we do to help you today? And that might include offering overdose prevention supplies, and that means Narcan, test strips, maybe some brief wound care opportunities to address some of those more complex needs. That also could mean some safe use supplies and making sure that we're preventing the spread of communicable diseases such as HIV and hepatitis C, and really trying to just meet a person where they're at. And underneath all of that is just to create a safe relationship where we can chat and just offer any help that that person is looking for that day. When you walk into the mobile unit, you'll find a very clean and organized space ready to help you with whatever your needs are. It's separated into two rooms. In the front room that you walk into, we provide case management. That's also where you will find the anonymous overdose prevention supplies and safe use supplies. This is the back room. This is our private medical and counseling room, and this is our fully functioning telehealth monitor here on this wall. We have access to doctors, counselors, case managers, nursing, both on rotations of in-person, having a doctor about once a month be on this unit, and also fully telehealth capabilities with Wi-Fi and power and direct access to a full team of people who just want to help. On the mobile unit, we have a fully self-sufficient restroom, which allows us to provide point-of-care urine analysis testing, or UAs. We have found that the barrier for some people to drive an hour once, twice a month to provide these testing has been a barrier to stay engaged in treatment for the long term. Through this grant opportunity, which funds this mobile unit, we're able to offer a unique opportunity for folks who are experiencing barriers. They can enroll in one of our grant opportunities if they are seeking Suboxone care. This includes free medical service, no insurance required. It includes free counseling and case management services, and includes incentives for continuing to engage with us and allowing us to help you. The money that's used to fund this program is currently aimed at lowering the barriers around opioid use disorder, but we are noticing that people are struggling with lots of substance use, and we are using this opportunity to also help anybody who's struggling with any substance use. We're working really hard because of the epidemic that happened, and what's happening is there's not the same treatment options for people with cocaine use disorder, and those treatments are less available and less understood by the general public, and it's not as easy as meeting with a doctor and getting a prescription. It's much more counseling and behavioral health oriented. And then the third part of that is all drugs are just becoming adulterated with fentanyl and xylazine, which is upping the addiction properties of these substances, just making, it's no longer just treating one substance, it's now treating 2 or 3 or 4 all at the same time, which comes with its own unique challenges around thinking about what that does to a person and the consequences that that could have for them in their life. Some of the unique opportunities to provide ongoing support to somebody who's been working really hard to navigate those barriers to get to St. Albans. We can now provide support to them in their hometown and to decrease the barriers and the stress of going through treatment or getting help. As a person who's been doing this work for a little while, the thing that still kind of sends chills down my spine is the people who have been seeking services in these programs for 10 years, and all of a sudden they're like, you guys are in Richford? Oh my God, this makes my life so much easier. It was a real hardship to try to get down to St. Albans every day. Some of those stories and connecting with those folks has been truly some of the most heartwarming experiences in my career.